And welcome to Central London for the clinical practice meeting. I have worn my red trousers just so that people will recognise me as a figure of authority from the countryside up here in the big smoke. Now, at our meeting today, the first thing we've done is we've written to WeatherBiz raising some concerns about their app that we feel is not working as smoothly as it might do. We have guidance coming out about sedating for paraprofessionals. So I think this has changed a lot in recent times. We don't feel that people have to remain there for the entire procedure, and that advice will be coming out in the next few days. Please, if you're on the BEVA AI list, please do fill out the semen tank survey. There is no data about semen tanks, and what happens with them, and we're looking to get some reliable data out there. So please do fill out that survey. We are writing to Tattersalls. There's been some concern that the form for vetting at sales that you get from Tattersalls is not quite the same as the one for the Veterinary Defence Society that you can get from their website, and so we are writing to Tattersalls, or arranging a meeting with Tattersalls to discuss that. We've been working for some time on the BEVA guidelines for euthanasia. That is largely complete now, and that will be coming forward. The next stage will be working on the appendices, the actual conditions that warrant euthanasia. But the key thing we've been working on or looking at is trying to recognise much more the role of chronic disease in this, and how chronic disease does matter. We reviewed meetings that we'd had with insurance companies relatively recently, the insurance liaison group. The insurers were concerned about veterinary inflation, and that was really their number one thing. We did point out that the two things is firstly, this is to do with drug inflation as much as veterinary professional fees inflation, but also it's because of there's increasing demand for and availability of more advanced diagnostics out there. The insurers are still concerned about fraud. When you're filling out insurance forms and writing vet reports, make sure that they're complete and accurate, and nothing is sort of being missed. Don't try and skew the claim one way or the other. We did raise the possibility of condition scoring at insurance proposal with the insurers. They were not that interested. They saw this as a significant source of conflict, and they don't perceive the obesity conditions as being a major cost or expense to them. RAMP, we'd endorsed RAMP a few years ago, the Register of Associations of Musculoskeletal Practitioners. We've now been asked by other groups, and we've discussed that. We will be talking to them. The one that I can tell you with absolute confidence, we will not be endorsing the British Equine Hygienists Association. That is the Willy Washers group, and we won't be endorsing them. There was discussion about the RCVS guidelines on 24/7 coverage. We feel that there's been relatively little change in equine practice, and we are, as such, we're not taking any further action there. What we are going to try and do is produce some guidelines about the legal position for sharing clinical history. We think that people, when they're faced with this demand for data, there's so many rules covering it. There's GDPR, there's client confidentiality, so we're going to try and get up with some clear and concise guidance on that. And then really the final part of the meeting was that the RCVS are seeking feedback from their stakeholders on their various initiatives. There was quite a bit of discussion about this, and I think it would be only fair to say to you that the view of the meeting was relatively negative on the performance of the RCVS. From their complex and bureaucratic GDP system, which we didn't feel was particularly beneficial, the concern about Mind Matters, that was an excellent initiative, but where's it gone? It just seems to have petered out. What the role of the RCVS Council was, and what the role of RCVS Knowledge was. That we recognised RCVS Knowledge as a good thing, but it seems to be independent of the RCVS. Shouldn't this be part of the RCVS itself? And more relevantly, shouldn't it be part of the membership fee? That was what we achieved at the clinical practice meeting today.